Keeping up with the ever-changing dynamics in the health sector, several health institutes were set up in Shillong in the early 20th century, and the Ganesh Das Hospital was one of them. In this episode of Shillong's iconic structures, we are featuring the Ganesh Das Hospital, one of the oldest and busiest health institutes in the state. Established in 1935, it is a state referral hospital for women and children. The Ganesh Das Hospital is set amid a concrete jungle with countless numbers of vehicles and people thronging the premises every day. Though that would not have been the site 50 or 60 years ago. It was said to be a landmark located atop a hill called Pasture Hill, surrounded by tall pine trees and overlooking the crystal clear Umkra River and the horse race course in Polo Ground. A beautiful view indeed. Let's further dive into the history of this hospital. As Shillong, being the capital of the then Assam province, witnessed fast growth in population in the first quarter of the 20th century, the need for a separate hospital to treat women and children was felt. With this thought in mind, a few concerned individuals, including renowned philanthropist late Jivan Ram Goenka, came together and raised money to build a hospital under the auspices of Countess of Dufferin Fund. This fund was established by Harriet Hamilton Temple Blackwood, the Marchioness of Dufferin and Ava, more commonly known as Lady Dufferin, in 1885, and was dedicated to improving women's healthcare in India. The foundation stone was laid by Lady Joyce M. Keane, the wife of Sir Michael Keane, the then governor of Assam, on November 22, 1933, and the hospital was completed and officially opened on December 3, 1935. The first medical superintendent was Dr. Mrs. G. Stapleton in 1935, and history has it that Dr. Bilyansi Paryat was one of the first Khasi women doctors who worked in the hospital during the British era. Have you ever wondered why the hospital was called Ganesh Das despite it being a government hospital? It was learned that late Jivan Ram Goenka donated his land and money for this hospital, and on completion dedicated it to his late father Ganesh Das Goenka. The hospital started with a bed strength of 32, which later increased to 68 as the number of patients grew. In those days, patients were referred from different parts of Assam and the northeastern region. At present, the official bed strength is 400 with an addition of 100 with the support of 55 doctors, including the medical superintendent and around 160 nurses. Arguably the busiest hospital in the state, Ganesh Das caters not only to the people of Shillong and its adjoining areas, but receives referral cases from different public health centers, community health centers of Khasi, Jaintia Hills and Riphoi district, and also from different central government organizations and establishments like the CRPF, the BSF, the military and the like. According to the hospital authorities, a minimum delivery per day is 30 and a maximum is 40, with a total number of around 8 to 13 cesarean section surgeries per day. Back in the day when the OPD was housed at the old civil hospital in Kandailat, doctors and nurses would travel back and forth from Kandailat to Laumali, causing much inconvenience for both the health providers and the pregnant and lactating mothers. But after the OPD was moved to the hospital premises, catering to the in-house and the visiting patients has become a lot easier, though the rise in the number of deliveries per day sees no decline. Over the years, the medical institution has become a go-to hospital for expecting mothers and ailing children, especially for rural folks. With technological interventions, many new facilities have been added to the hospital, like a refurbished operation theatre, a labor room, the X-ray department, the pathology department, the pediatric and others. Other than these, the hospital has different facilities like the OPD, the 24 hours emergency services, the antenatal and postnatal clinic, surgical, gynecological, maternity and child health, laparoscopic surgery, ICU, well baby clinic, counseling ICTC, adolescent clinic and others. Back in the day, the hospital was run by officials belonging to the Women Medical Services, which was an all India cadre of the government service. When India gained independence, the Women Medical Services was abolished and there was no trained administrator to run the hospital. Hence, the Women Medical Services personnel were requested to continue until until 1949, when the hospital was provincialized and placed under the Director of Health Services, Government of Assam. At present, the hospital is under the Directorate of Health Services, Government of Meghalaya. If we talk about the architecture of the old building, here's a piece of information you might find interesting. Since the memory of the 1897 Great Earthquake was still fresh in the minds of the British back then, constructing an earthquake-resistant building was mandatory. While timber frame walls, commonly known as ecru walls, were the preferred choice for a building in those days, the architects of Ganesh Das, however, felt otherwise and chose steel cast inside the concrete wall to prevent it from easily falling off. The old structure, with high ceilings, proper ventilation, old chimneys and wooden floors, remains more or less the same except for leaked ceilings at several wards and minor electrical repairs. Many departments, including the wards, which were once housed in the old structure, have now been moved to the new building earlier this year. The new 3-storied concrete building is located just next to the main building. Since most of the departments and wards have been moved to the new building, more than half of the old structure is empty, and whether the government chooses to retain the old structure or demolish it, it is yet to be known. Did you know that in 2009, Ganesh Das was selected as one of the hospitals in the Northeast to be certified for ISO 9001-2008 standard, a quality management system? After repeated auditing, the hospital was certified for the ISO in December 2010, the first hospital in the state to achieve this distinction. What's in the name? Much like how the name Robert is associated with the Dr. H. Gordon Roberts Hospital in Jayal, similarly, people, especially those hailing from the rural areas, would call the Ganesh Das Hospital Laumali. The hospital was renamed Ganesh Das Government Maternal and Child Health Hospital Shillong in 2016. This hospital also has 2 training institutes, the General Nursing and Midwifery, or the GNM Training School, which started in 1958, though training for midwives started earlier than that in 1935. The other is the Auxiliary Nurse Midwife, or ANM, which was started in 1958 and continued till 1977. However, in 1979, it was upgraded to the Female Health Worker Training School. For 87 years, Ganesh Das Hospital has been a beacon of hope for the people of the state, especially those belonging to financially challenged families. Despite several challenges, the hospital has stood the test of time and continues to render its services.